Hey, I'm Dr. Roderick Chandler. Today I'm going to be taking you into the operating room to show you a rotator cuff repair. First, we insert the arthroscope into the shoulder joint. We start inside the joint and take a look at the cartilage, looking for arthritis, and the other soft tissue, looking for any soft tissue damage around the joint. We'll clean up all of the inflamed tissue, address any other tears that need to be cleaned up or repaired at this time. And then we can look at the rotator cuff from the undersurface and see how much tearing is evident in the shoulder joint. From there, we will then move the arthroscope above the rotator cuff into what we call the subacromial space, and we'll clean out a lot of the inflamed bursa and soft tissue that obscures our view and also is a source of pain. So we want to clean all that out of there. If there's any spurs, we'll shave those down. And then usually at this point we have a really good view of the rotator cuff and can evaluate for whether there's a tear and the size of the tear and the quality of the tissue. Once we determine that this is a tear that we are going to fix, we will pass some sutures through the rotator cuff and then insert some anchors, which are absorbable corkscrew devices that go into the bone. They will dissolve typically over time, so you're not left with any implants in the bone. But what they do is they attach to the bone and give us something that we can now pass the sutures through the rotator cuff, and when we tie those sutures, it will pull the rotator cuff down to the bone and allow it to heal. Once we've repaired the rotator cuff, we take a look, make sure we're happy with everything, and then we just close the small incisions with either sutures or staples. Okay, so now that we're done, the patient is going to a recovery room, and he'll typically be there for 1 to 2 hours. It is an outpatient surgery, so he can go home the same day. He is immobilized and will have to protect the shoulder for the first couple weeks, and then after that we'll start therapy. Most patients will do several months of therapy before they're at a full recovery. If you have any questions, comment below or visit us at avalaortho.com.